Hello everyone, I am Dr. Nithin, Department of Neurosurgery, Kasturba Medical College. Today I am going to talk something about condition called brain aneurysm. Brain aneurysm is not that common but not really understood topic for a general public. Brain aneurysm is kind of a swelling in the brain or a vessel in the brain which can rupture and cause bleeding. For a common man, if I want to explain, it is like a garden hose in your garden, like the pipe in the garden house which can just swell up at some point and it leaks the blood from the vessel. In that case, the brain aneurysm becomes the most severe condition for any general public. The condition usually presents mainly in female patients, some chronic smokers, or some family history of previous brain aneurysm. So these are the risk factors which patients should be aware of whenever they have some headache, severe headache, or some kind of a dizziness. So brain aneurysm can present in many ways. The patients or the general public usually are unaware, or they will just avoid coming to doctors for simple headaches. So that can be an aneurysm headache which can be a warning for the patient. During these conditions, when patient have a common headache or they have some dizziness, lightheadedness, it's better not to avoid going to doctors. Go check on the doctor and see what is happening in the brain, get a scan done. They usually come either just a simple headache, which incidentally we get a scan done and we'll see a swelling in the brain, or they come usually with a severe form of symptoms like it can rupture and cause bleeding, and patient can come in a very severe bad state like unconscious state, or they can come in a state of seizures. So these are the ways the brain aneurysm can present. Whenever patients have a headache, or whenever they have a giddiness, or whenever they have lightheadedness or some pain behind the eye, they should not just leave it calmly. They should have to attend the doctor and see what is happening in the brain. We have multiple ways of treating the patients in the brain aneurysm. The first is we will go for an investigation. Whenever patient come, we will get a CT scan or an MRI to see what is happening in the brain, like what is happening to the vessel, what is happening to the brain and swelling and all those things. So once we get a conclusion, there are different ways of treating the brain aneurysms. There are multiple ways. If the patient is come with an aneurysm which is not opened or which is not ruptured, we can still follow it up with some medical management. No need to go for any intervention. If the patient has come with the rupture of an aneurysm with severe state of condition, then we have other options like either an endovascular coiling, where we pass an artery or a vessel into the blood vessel and we will put a coil inside the aneurysm. If that is not feasible, the other option we have is open procedure, where we'll open the skull bone, we'll put a clip into the whatever ruptured vessel so that the aneurysm will be secured. The conclusion message which I want to give in this state is take care of your brain. Brain works hard. So be aware of your brain, what is happening. Go to the doctor, get the investigations done in case of any minor headache. See if there is any issues in the brain so that the awareness will be spread to the general public. Thank you.